Hi everyone, my name is Ariel Eaglin, and the chapter that I was assigned to was Chapter 5 entitled Policy Design. I chose Case Study 3, which was teen pregnancy in South Carolina, and this case study outline basically talks about that there are high teen pregnancy rates going on in South Carolina, and there are 5 graduating nursing students who want to see the different criteria to actually evaluate this issue and create a policy to see how they could actually lower the teen pregnancy rate. They started with 2 types of criteria that they actually evaluate the situation on. This first one was evaluative criteria, and then the final was practical criteria. And they used this to come out with 3 different outcomes. One outcome was to do nothing. The second was to retain the current policy, but add a mandate that addressed the issue. And the final one was to overhaul the current policy to address the issue from all sides. And they created a detailed discussion about this to see how they could actually use this to create the policy and figure out ways to challenge it. So with that being said, the tools and their underlying assumptions can affect the outcome of a policy to reduce teen pregnancy because they can contribute to the success or failure when implementing and creating the policy. There are 5 different types of tools mentioned in the book. However, the tools that advanced practice nurses can best use to reduce teen pregnancy when creating the policy are capacitive building tools, symbolic or hortatory tools, and learning tools. Building tools are tools that provide education through training and other resources to the population and help them learn about the cause of the issue. For the tool to actually impact the population has to become aware of the actual risk factors in the area, which in this case is teen pregnancy, and be evaluated on the issue. The educational information can be distributed to the target population in many ways, such as brochures, email videos, or YouTube videos, and also different informational sessions or presentations that usually happen at maybe healthcare fairs. That could be one. And then another tool that can be used is symbolic tools, which is also hortatory. This tool shows that people are motivated within. When comparing that to this policy issue about teen pregnancy, the population would have to actually be motivated within themselves to actually want to make a change and change their habits based on their beliefs, their personal values. And finally, the last tool is the learning tool, which helps when the resources the target population might need are actually unknown. So in this case, they would actually create a needs assessment to be used for that population to figure out what that population wants, their issues, and ways they can actually help that population. These tools are important because they can help and educate other policymakers on this issue and persuade them to either support or oppose the policy. So the assessment actually gives a general understanding of what is needed, and it lets the policymakers know from the people within themselves and not people assuming that they know what they need. And finally, when examining this issue and creating the policy for reducing teen pregnancy, this is a great time for different healthcare professionals to come together and use their knowledge to design a great policy. Usually because these healthcare providers have experience in this area and are further in this area and or know methods that can help reduce teen pregnancy, they are asked to sit on a panel to further discuss the issue before it is actually presented. In this particular case study, these healthcare professionals can be involved in the process of creating informational sessions, brochures, also the educational videos that can educate the target population on teen pregnancy. The healthcare professionals can also work together to create the assessment and find out what this target population actually needs and how they can provide those things for them. With healthcare professionals involved in the designing of the healthcare policy, it ensures that the information given out is good health related material, and if prevention methods involving medicine needs are needed to be used, they can actually make sure that the right medication is being used instead of someone from the government just giving out just some random thing for them to use and expecting that to work and affect the population. So I ask you guys, since this chapter is all about creating policies, what policy tool do you actually think could best benefit this population where teen pregnancy needs to be reduced?